In front of you, you see a typical setup for a crown and bridge impression. This is the gun material, or the gun equipment to inject the cartridge material into either the tray or directly into the mouth. Again, there's two tubes of material here, and they get mixed in a spiral swirling mixing tip, and that causes them to start to set. We're going to use a quadrant impression tray, and we're going to be taking an impression of our crown preparation here, tooth number 2. I think you can see the crown preparation right here, and that's the one we're going to take an impression of. We're going to use putty, what's called a putty and wash technique. This is a very light, runny material, and that's going to be injected around the tooth. This is a putty material, and this is what the assistant will be mixing. I'm not wearing gloves because you have to mix the putty without gloves because there's chemical contaminants on the gloves which will inhibit the set of this material. There's no infection hazard or anything like that because you're not going to be putting your hands in somebody's mouth without gloves on. The only thing you, the assistant, are going to be doing is mixing this putty, placing it in the tray, and then handing it to the dentist who will put it in the mouth. So we're going to do all of this simultaneously, and you'll see how this works. First of all, we want to make sure our gun here is ready to go. So we're going to assemble this by putting the cartridge in like that, and then advancing the little plungers. And what you must always do when you put either on a fresh one or a slightly used one like this is to squirt a little bit out of the end to make sure that both tubes are working. And I'm going to do that right now. I think you can see that both ends are coming out. Okay, so I'm going to wipe that off like that. And we're going to put our mixing tip. I think if you see the little, this is how it gets mixed. When the material goes through those little curves and pieces of plastic in there, the two materials from both tubes become mixed. So that's going to go on just like this. It goes on and then twists, and it's locked into place. And because we're going to use this to inject directly around the tooth, I'm going to put a special little tip on the end which will allow me to squirt it directly around the tooth and get it into the sulcus like this. So this is what the dentist will be doing while the assistant is mixing the putty. I'm going to be doing both things here for this procedure, but normally the assistant mixes the putty and while the dentist is squirting this around the tooth like this. Okay, so the first thing we're going to do is get out some putty here, and again, because we don't want to contaminate one from the other, we're going to get out, there's 2 scoops in here, one for each mixture. I'm going to just estimate how much I'm going to need to fill this tray. I need about half of this, and remember there's going to be an equal half of the other one. Put the lid back on and open the other jar. This happens to be a Finis. It's by Coltene. It's very good material. And I'm going to get out another lump, and again, you can set it aside or have it ready to go. It won't set as long as you don't mix these two together. All right, I think we're ready to go, and we're going to get a little closer here. Now I'm being the assistant's role, and you knead this together until the color is almost uniform. Kind of has a little marbly texture right now, and you just keep squeezing it until it starts to become uniform. You're going to press it into the tray like that and have it ready for the dentist. The dentist, in the meantime, is going to be injecting this material around the tooth like you see here. When that's completely around the tooth, he will ask for the tray from the assistant, and the tray then will be seated in the patient's mouth and pressed down, and that's it. There's no water for this. The two components mix together, and this will set in about 3 or 4 minutes. So we'll come back to this after it's set. Here's our final crown impression. The material is hardened now, and it's ready to be taken off and examined. Again, we would do this in the mouth just by lifting it out like that. And I think you can see that it's captured the impression of the crown preparation as well as the teeth in front and behind. A little bit of a void here because this tray does not fit the plastic model very well. But again, you can see the idea between using the thin wash combined with the thick putty. The thin wash goes into all the little cracks and crevices much better than the thick putty, but is too flimsy to use as an impression material. So the thick putty provides the rigidity, and the thin material provides the detail. There's another way to take an impression, and that is using what's called a triple tray. And we'll talk about that in just a second. This is a triple tray technique which will take an impression as well as the opposing impression of the teeth simultaneously. It's a very easy way to take a final impression for crown and bridge. The assistant does not have to take the opposing teeth in an alginate impression, and it saves a step. Basically, the materials are the same. We use the same putty and the light body wash. In other words, if we were doing number 2 again, we would, while the dentist is injecting the light body material around tooth number 2, the assistant is mixing the putty, except instead of loading it in a quadrant tray, the assistant will make a sausage and fold over one on the top and then come back over and fold it over on the bottom. So once there's putty on this side as well as on this side, it's ready to go in the mouth. Remember, by this time, after the assistant has loaded this with putty, the light body is been injected around the tooth, and the dentist merely inserts this putty triple tray in here and has the patient close down into it. As the patient closes down into it, you can imagine that it is taking an impression of the lower teeth as well as the upper teeth and capturing the detail of the crown preparation as well. And this is the end result. Here's a triple tray impression, and again there's our crown impression, with the blue being the light body wash, the brown material is the putty, and that's one side of that's the upper teeth, and at the same time this triple tray took the lower impression as well. So it gets its name. You might say, well, what's the third thing if it's called a triple tray? Well, it does 3 things. It takes the lower impression, or the counter impression, it takes the upper impression, which has the crown prep on it, and it records the bite at the same time. So it does 3 things: upper impression, lower impression, and the bite. It's a very effective and very time-efficient way of taking a single tooth or 2 teeth crown preps or other kind of indirect restorations.